Good evening, everyone. Welcome to another episode of the Apex of Training and Development Cancer Awareness Program. This program is brought to you by Nagico Insurances. Nagico Insurances is located in 21 territories across the Caribbean, as far north as the Bahamas and as far south as the ABC Islands, that is Aruba, Bonaire, and Curacao. For more information on the services that are offered by Nagico Insurances, you can visit their website at www.nagico.com. This evening, we have a very special group of persons here to discuss gynecological cancers. Tonight, we have in our mix Dr. Ephraim, who is no stranger to the Apex of Training and Development Cancer Awareness Program. And we also have a cancer survivor, Miss Cassie Pascal, and the niece of a cancer patient who has since passed on from uterine cancer, Miss Shanti Stapleton, and they are here to share their stories. So to start off this evening session, Dr. Ephraim, we're going to begin with you. For persons who may not be very familiar with you, tell us who you are and what are some of the services that you offer and where are you located?
Good evening, Sherian. Thank you for having me once again. My name is Dr. Darren Ephraim. I am a gynecologist. I am a consultant at the Mount St. John's Medical Center and also at the Ephraim Medical Clinic. The Ephraim Medical Clinic is located in Lower Gambles, and we offer a wide range of obstetric and gynecological services. So anything from pregnancy to gynecological cancer to fibroids, anything like that, you can get treatment at the Ephraim Medical Clinic in Lower Gambles.
Thank you, Dr. Ephraim, for giving us a little brief overview on who you are and some of the services that you offer. We also have another very special guest, Miss Cassie Pascal. She is a cancer survivor. Cassie, thank you so much for mustering the courage to come here to speak to us about your experience. Tell us a little bit about your journey as a uterine cancer survivor.
Um, Good evening. My name is Cassie Pascal. I was diagnosed last year, July, with uterine sarcoma. Um, my journey is a long one, not a pleasant one. I've been through a lot of hiccups, where financially, medical benefits, not being able to have surgery. So I'm here doing chemotherapy, which I don't have much side effects from chemotherapy. I don't get any nausea or vomiting, but I do have some breathing issues. Um, I was diagnosed with bilateral pulmonary embolism, and then 2 weeks after, I was diagnosed with pneumonia. So I've been back and forth, in and out of hospital, struggling with my lungs because I'm also asthmatic. So it's just a long, painful battle. I spend, but I do spend a lot of time with family and church family. So they're my support system. If it wasn't for them, I think I would have died already because there was one point where I had actually given up.
Thank you, Cassie, for sharing your story with us. I'm afraid our next guest is experiencing a little technical issue. So, Dr. Ephraim, we're going to go with you. But before we continue with you, I would like to encourage those persons that are joining us via any of our social media platforms to share the live and to encourage a friend or family member to tune into the Apex of Training and Development show to get some more insight on gynecological cancers. We have Dr. Ephraim with us and Cassie
Mhm.
Pascal, a cancer survivor. Dr. Ephraim, what are gynecological cancers?
Well, gynecological cancers are any cancers that affect the female reproductive organs. So we're speaking about ovarian cancer or cancer of the ovary. We're speaking about endometrial cancer or uterine cancer, which is cancer of the uterus or womb. We also have cervical cancer, which is cancer of the cervix, the lower part of the womb, the funnel of the womb, so to speak. And of course, we can have vaginal cancer or vulvar cancer. In other words, cancer of the vagina, which is the tubular organ inside of the woman, what we do not see, and of the vulva, what the outer genitalia of the female. So those are the gynecological cancers that you will find. Now, the incidence of these cancers will vary from country to country. Typically, you will find that in developing countries, like the Caribbean, some of the countries in Africa, some of the countries in South America, that cervical cancer is usually the most common cancer. It is the most frequent cancer, and that is generally because of a lack of screening, a lack of resources to screen, or also a lack of interest or education to screen. And when I say screen here, I'm referring specifically to the pap smear. Now, in the more developed countries, you will find that endometrial cancer or uterine cancer, cancer of the womb, is generally the most common cancer in these countries because in these countries, screening for cervical cancer is generally more abundant. The resources are there for screening, and the education to screen is there, the interest to screen is there. And so, generally, the numbers of cervical cancers are generally less in the developed countries. So, you will find that uterine cancer or endometrial cancer is generally the cancer of choice, or generally the more uh, frequent or common cancer in these more developed countries.
Now, is it a situation where we don't have the resources available in the Caribbean to screen for the vaginal cancer? Because I've never really heard about screening for vaginal cancer and the uterine cancer.
Well, no, no, no. We don't generally screen for vaginal cancer. We generally screen for cervical cancer, for cancer of the cervix. Okay?
Mhm.
So there is no uh, reliable screening method for vaginal cancer or cancer of the vulva, the external female genitalia. Okay? But there is an adequate screening test for the cancer of the cervix, in other words, for cervical cancer, and that is the pap smear. Now, what we find is that well, I can speak of the Caribbean, we do have the resources to screen for cancer of the cervix. What is not there is the education of the general population to screen. So you find that a lot of women do not know what a pap smear is. A lot of women may not know when they need to start screening, how often they need to start screening. And in general, the interest to screen may not necessarily be there because, as I mentioned, the education to screen has not really been disseminated as it should be.
All right, thank you so much, Dr. Ephraim. Cassie Pascal, when you found, what were some of the signs that you saw that prompted you to seek medical advice before you were actually diagnosed with uterine cancer?
Um, I actually had a emergency surgery where I had to remove uh, fibroid, and there's where the masses were found. I didn't really experience any signs, and I'm not one. I wasn't a person that like to go and see doctors. So I that was one of my biggest mistakes, not going for my regular checkups and these kind of things. So I start experiencing some stomach pain, um, telling my husband it's gas pain, but it turned out to be a degenerating fibroid. And Dr. Ephraim was the surgeon that removed the fibroid, and there's where they found the masses.
Wow. Dr. Ephraim, are there any signs or symptoms of uterine cancer or vaginal cancer?
Well, in the case of uterine cancer, and I think Miss Pascal's case was a very interesting case, but let me speak first of uterine cancer. Uterine cancer generally is going to affect women who are a little bit older, generally. It is generally not a cancer that you're going to see very often or in, let's say, women under 40 years of age. Generally, you're going to notice this cancer in women who are post-menopausal. In other words, they have already gone through the menopause. They have already gone through the menopause, and suddenly, a few years later, they have very slight vaginal bleeding, very, very slight. Typically, that is the problem because the bleeding is so little. It's just a little bleeding, maybe just a little bleeding for a day or so, and then it stops. So let's look at a scenario. You may have a woman who is, let's say, 58. She went into the menopause at about, or she entered menopause at about 51. In other words, she saw her last menstrual period at about 51. And suddenly at 58, she has a day of bleeding. So she bleeds a little bit, not maybe not enough even to fill a liner, just a little bit, and then it stops. So the mistake is made right there because the bleeding is very slight and because the bleeding is not that much and that it resolves on its own. Typically, the ladies do not seek medical attention for that bleeding. And that is the message that we need to get out to women. As long as you have entered the menopause, in other words, as long as you have stopped the bleeding for more than a year, as long as your periods have stopped for more than a year, and you are now around age 50, your periods have stopped for more than a year, you're most likely in menopause. 5 years later, you should not be bleeding at all. So if you notice even a very slight bleed, you should seek medical attention for that. Okay? So the mistake is usually made there. Most of the women do not seek medical attention for that slight bleed. And a few years later, then the cancer is already there. It has already established itself. And that is usually the development or the beginning of uterine cancer. In the case of vaginal cancer and vulvar cancer, typically it's an older lady as well, generally after the menopause, and what she's going to notice is persistent vaginal itching. Okay, so if you notice an older lady, an older family member who is just complaining of vaginal itching, vaginal itching, vaginal itching, then that really needs to be checked out. Now, it might turn out to be an infection, but generally after the menopause, there is a dramatic drop in hormone levels. And so typically these ladies are not going to have these types of infections. But a woman, let's say over 60, who is typically complaining and complaining of this persistent vaginal itching, a biopsy of the vulva should be done to determine if it's vaginal or vulvar cancer. Now, in the case of Miss Pascal had a very strange or very rare uterine cancer. It is something that is called a uterine sarcoma. And that is where typically some fibroids, they undergo a malignant change. So when Miss Pascal first came to the hospital, she came with significant abdominal pain, and she was referred to the general surgery department, who suspected that she had an appendicitis. And of course, while doing the operation, they realized that something was wrong. What they were seeing, they were not accustomed to. And so I was called in. And, after I looked at the situation, we decided to take some biopsies and to remove some masses. And these were removed, and eventually the diagnosis was of uterine sarcoma.
All right, thank you, Dr. Ephraim. For those of you who are joining us via any of our social media platforms, remember to share the live, and remember you can leave a comments in the comment section of each of the pages. Our panel will be more than happy to respond to your questions. We're going to invite Shanti Stapleton in the discussion. She is the niece of a patient who has passed on from uterine cancer. Miss Stapleton, when you found out your aunt was diagnosed with uterine cancer, what was your first reaction?
Well, when I first heard about the cancer, every time I hear cancer, death. So I started to cry. And she got upset, looked at me to face and said, "The cry coming out dead." So I started to feel a bit of relief because she was confident that she wasn't going to die. So I had no choice but to be confident with her. Then she told me that she is she'll most likely become ill because of the chemo and the radiation and so on. But it didn't really do her anything the first time. But the second time was when it hit hard, and that was the hardest time ever. It hit hard, real, real hard.
All right, Miss Stapleton, we apologize for your loss. We're going to give you a moment. Thank you for having the courage to speak up about your aunt's experience. And I'm sure your message is really touching persons that are can- cancer caretakers. So just be of good courage. Thank you so much. Dr. Ephraim, is there a connection between HPV and gynecological cancers?
Yes, definitely. And specifically with cervical cancer, with cancer of the cervix. So HPV is the causative agent. It has been shown, the evidence is there that the HPV virus is the major causative agent involved in cervical cancer. And we're speaking about high oncogenic strains of HPV. There are some strains of HPV which do not cause cancers, okay? But there are other strains that are definitely implicated in the development of cervical cancer.
And what about I know you mentioned the older the patient, the more likely it is that patient will develop or can develop uterine cancer. But
Mhm.
what if somebody in their 30s or early 40s begin to miss their periods for over a 6-month period? Should there be a concern?
Well, if someone misses their period, if someone is very young and they miss their period for an extended period of time, initially we won't be thinking about uterine cancer. We will be thinking about some sort of hormonal dysfunction. We'd be thinking about perhaps is the person going into early menopause, for example. Do they have something that is called premature ovarian failure, where the ovaries shut down at an early age, generally before 40 years of age? So these generally, if a patient does not is young and does not see their menstrual periods for 6 months or so, we wouldn't necessarily be thinking about the uterine cancer. Now, suppose the patient is young, let's say the patient is between ages 30 and 40 years old, and they're having very significant, persistent, heavy bleeding. So they're having menstrual periods that are going on for more than 10 days on a regular basis, and perhaps the periods are coming a little faster than they should. Um, in that case, we may say, let's investigate, let's do an ultrasound, and let's see what the thickness of the inner skin of the womb, what it looks like, if it's very, very thick or not. Because in some cases, if it is very, very thick, we would want to say, well, let's take a biopsy, let's do an endometrial biopsy, because this patient may have not necessarily endometrial cancer, but they may have a precursor to endometrial cancer, which is known as endometrial hyperplasia. Okay? So, endometrial hyperplasia is not necessarily cancer, it's not necessarily womb cancer or endometrial cancer, but it is a precursor that could develop into womb cancer. So, we would want to investigate for that.
And what can the patient do to prevent themselves from actually getting the cancer if it's a precursor? Is there anything that can be done?
Well, I don't think that anything can be done to prevent uterine cancer. There are no studies that have shown that any particular action will prevent you from getting, uterine cancer. In fact, any gynecological cancer. Um, and I don't think the preventative measures are really there. So we can't say, well, look, I'm 25, let me start to do X, Y, or Z to prevent gynecological cancer. What you can do is to screen adequately. Okay. In the case of cervical cancer, try and get your pap smears as indicated by your physician. In the case of uterine cancer, check your gynecologist at least once a year. Perhaps do an ultrasound if there is a need to. Okay. If there is something suspicious, you probably would want to do an ultrasound so that the cancer, if it is there, can be detected early. And in the case of the precancers, the precursors to cancer, they can be detected early and they can be treated. That is the idea, to screen or to get regular checkups so that these things can be detected in the early stages so that they can be dealt with hopefully before they develop cancer. And if they do develop cancer, that they can be detected in the very early stages, because that is the idea of beating gynecological cancer. It has to be detected in the very early stages for us to have any chance of success in treatment.
Remember, for those of you who are joining us via our social media platforms, you can leave your comments, and our panel guests, they'll be more than happy to respond to your question. Siobhan Stevens, all the way from Canada, who is one of our very faithful guests. He's saying good evening to the panel. Good evening, Siobhan, and thank you for joining us. Now, Cassie, we're going to go back to you. What sort of coping mechanisms have you used in order to cope with the reality of being diagnosed with uterine cancer?
Sorry. To be honest, I didn't have any. I spent a lot of time crying when I first got my diagnosis. Um, I just thought that it was just going to be the end because it said stage four. So I'm here thinking stage four, that's the final stage. There's no turning back. So I just cried and cried and cried some more. And then my mom was my support system, my rock. She would call me every day and she would pray with me, although I didn't want to pray. And she would just keep doing it every day, just keep praying and keep speaking, just keep motivating me to get up and exercise and make sure I eat. But I didn't want to do it, but I did eventually. And I guess it was a little too late, hence the structure of my body right now because I've lost a lot of weight. by not eating and feeling like it's the end. So that is one of the ways how I cope. A lot of crying and my mom praying.
Thank you so much, Cassie. We're going to go back to Shanti Stapleton. Now, you were the caretaker of your aunt. What did you learn from that experience, taking care of your aunt? And what would you like other caretakers to take away from your experience as a cancer caretaker?
It's frustrating, very, very frustrating. It took away a lot from my life because I didn't get the chance to do anything that I wanted to do. So, what I would tell all the people to do is to just be patient. They will harass you a lot because they can't do a lot for themselves, but it's just, you just have to cope with it. She wasn't really a harassing person because she slept a lot too. She was always tired, didn't eat much after a while, didn't drink much after a while. So I didn't really have to do much after a few months. But the first few months was hectic. I couldn't sleep, I couldn't eat, I couldn't do anything for myself because as soon as I turned around, I had to go to do something else for her. And I didn't really have anybody to help me cope. I had nobody but myself. So it was just me and her every day, all night. So to take up some of my time, I cooked and baked a lot. That's what helped me get my mind off of things. Cooking and baking. Otherwise, it was just me.
Thank you, Shanti. Take a moment. Take a moment. Dr. Ephraim, we're going to go back to you. Is a diagnosis in cancer a death sentence?
No, it's not a death sentence. However, the stage, as I've always said, the stage in which you detect the cancer is very important because the chances of survival decrease with the stage. Okay, so it is very important that we detect the cancer as early as possible. If the cancer can be detected, in a stage one or stage two, then the chances, we as physicians, we will feel much more confident of the chances of survival. However, it is not a death sentence. There are persons who have stage three or stage four cancers who have survived for quite a number of years, and it all depends on the overall strength, physically, of the person, mentally as well, because the mental factor has to be there. I've seen quite a number of patients who have stage three cancers who, once they get the diagnosis, you can see it that they basically give up and they go quite quickly. Whereas others who are willing to go through the process, as frustrating as the process might be, tend to hang in and live for quite a number of years.
Dr. Ephraim, what are some of the treatment options available for persons who have been diagnosed with gynecological cancers?
Well, for gynecological cancer, as with most cancers, there are three major pillars of treatment. Okay, so initial treatment will be some sort of surgery if the stage uh, permits it. And then you're going to be looking at possible radiation and or chemotherapy. Okay, you have to pay special attention to the diet as well, the diet and nutrition of the person, So you'd probably want to consult with a dietitian or a nutritionist of some sort. Depending on the severity of surgery, you may need some sort of rehabilitation specialist that will help with the whole rehabilitation process. Those are the major pillars. For example, for most gynecological surgery, there's a process that we have to we have to do, and that is called staging. So staging generally involves some sort of surgery, some sort of surgical process to get an idea of what stage the cancer is in. So, for example, once you have diagnosed that, hey, this person has, let's say, uterine cancer or womb cancer, then you would want to know, is it in a stage one or stage two or stage three? That may involve doing what we call an exploratory laparotomy, where we open up the belly of the patient and we take out, some different organs. We take out the womb, we take out the cervix, we take out the ovaries, and we send all of that to the pathologist, and the pathologist will then look at the different organs in great detail, and they will tell us, hey, this has spread to the ovaries, or it has spread down to the cervix, down to the vagina, etc., so that we can make a determination of the stage of the cancer. Okay. We will also need some imaging studies, maybe some CT scans, some MRIs, etc. And we put all of that information together and we determine what stage the person is in. Depending on the stage that the particular patient is in, then we decide, depending on the stage and the type of cancer, we decide what additional treatment they would need, whether chemotherapy, whether radiation, etc., etc., etc.
All right, I just want to inform those of you who are tuned in. Nurse Imelda Benjamin, who is a nurse at the Mount St. John Medical Center in Antigua, would like you to know that there is support available for persons that are diagnosed with cancer. No one fights alone. Even for those of you who are tuning in from across the region, there's also support virtually. So you can contact Antigua Barbuda Cancer Support Community at 722-1019. And for those of you who are outside of Antigua, the area code is 268-722-1019. Thank you so much for tuning in, Nurse Benjamin. All right, so now that we've looked at some of the treatment options available, Cassie, I'm going to get back to you. You would have undergone treatment. What was that experience like, and what were some of the side effects you got from your treatment?
Um, one of the major side effects was constipation. I did not experience nausea or vomiting, and I'm grateful for that because I don't like to vomit. Um, but constipation was my biggest issue, and it developed a fear for eating. So I lost my appetite and I lost a lot of weight. So that was one of my major side effects from chemotherapy. I don't know what medication caused the constipation because they give you some tablets to drink after your chemotherapy for about 3 or 4 days. So I don't know which one of the medication caused the side effect, but that was one of the major side effects I had.
Thank, thank you, Cassie, for sharing your um, experience as it relates to treatment. Dr. Ephraim, you mentioned earlier that, well, you would have mentioned several things, but my question is the HPV vaccine. Can the HPV vaccine prevent gynecological cancers?
Well, I wouldn't say it prevents gynecological cancer. It prevents cervical cancer, cervix cancer. It prevents cancer of the cervix. It basically, getting the HPV vaccine at a very early age dramatically reduces your risk of acquiring the HPV virus. And remember, we said that there is a direct link between the HPV virus and cervix cancer. So, getting the HPV vaccine when you're 11 or 12 years old would prevent you from acquiring the HPV virus once you get into your teenage years and you begin to engage in sexual activity. That is where the danger is. Most people who contract HPV probably contracted the HPV, when they're in their teens or late teens or early 20s. That is generally when most individuals are most sexually promiscuous and will be liable to take, chances in terms of unprotected sexual intercourse. So, the idea is if we can administer this vaccine to persons when they are 11, 12, 13 years old, by the time they get to 16, 17, 18, and they begin to experiment with sexual intercourse, the vaccine, they would have already been vaccinated. And so the chance of them acquiring the HPV vaccine would be much less. And specifically the strains of HPV vaccine that are implicated in cervical cancer. Okay, so the HPV vaccine, I wouldn't say that it prevents gynecological cancer because it's not going to prevent ovarian cancer, it's not going to prevent cancer of the womb, it's not going to prevent cancer of the vagina, but definitely cancer of the cervix. It is definitely one of the best preventative measures that we have in terms of cancer of the cervix.
What about health and wellness? Because we spoke of the connection between the HPV and those cancers, but health and wellness, how important is that? Can health and wellness reduce the likelihood of someone getting cancer? Well, gynecological cancer?
Yeah, definitely, definitely. The immune system plays a very important role, and especially with cervical cancer, because as I said, cervical cancer is caused by the HPV virus. It's caused by a virus. So the immune system, HPV is really a relatively weak virus. It is not a very strong virus. It takes a very long time the to enter the body. And in many cases, when it enters the body initially, if the person is strong enough, if the immune system is strong enough, the immune system may actually flush this HPV, flush out the HPV. So you have a lot of women, for example, who may do a pap smear, for example, and the pap smear may show that they have an HPV type change on the cervix. They don't have cancer, but they have HPV type changes on the cervix. And you wait a few months, you may wait a year or so, and they come back, and the pap smear is normal. And the reason for that is that their body has been strong enough to flush the HPV out of the system. So definitely health and wellness, getting your immune system in a good condition is very important, particularly when you're young, when you're in your 20s and so on, to prevent, being contracting this HPV. Okay?
All right, thank you, Dr. Ephraim. Cassie, I'm going to go back to you. Apart from the support you would have gotten from your family members, what external support did you receive from organizations in Antigua and Barbuda?
Not much. There weren't much organizations that were available to support you. You reached out to them for support, but they turned you down. Um, I said maybe it was due to COVID-19 at the time, but there wasn't much support system in the business area or any private organizations. The only support I got was from Nurse Benjamin. She reached out to me through my aunt, who's a cancer survivor also, and her daughter is a 5-year cancer survivor. That was the support system I got, other than my family and church.
All right, just a reminder for persons who would like to assist cancer patients, you can contact Nurse Benjamin at the Mount St. John Medical Center. She is the president of the Antigua and Barbuda Cancer Support Community, and she believes that no one fights alone. They're all in this together. So you can contact the Antigua and Barbuda Cancer Support Community at 1268 722 1019. Again, the contact information is 1268 722 1019. All right, so Dr. Ephraim, COVID 19 is the topic of the day at the moment.
That's right.
Should cancer patients be vaccinated? And I'm sure many of them would like to know that. Just a reminder before you respond to this question, those of you who are tuned in via any of our social media platforms, remember you can ask your questions via the comment section. Dr. Ephraim and our guests, they'll be more than happy to respond to your question. Don't be afraid. Feel free to ask as many questions as you would like. Go ahead, Dr. Ephraim.
Okay, so we all know, I think by now we all know that most of the people who die from COVID 19 have what has been placed into a big basket underlying medical conditions. Okay? And these are medical conditions which, for one reason or another, are going to weaken the immune system. So, patients with uncontrolled diabetes, patients with uncontrolled high blood pressure, patients with underlying infections, someone who is HIV positive but does not know that they're HIV positive. These patients, when they contract COVID 19, they tend to become more seriously ill, and these are the patients who tend to die, more rapidly. Not saying that someone who does not have an underlying medical condition will not become seriously ill or die of COVID, but the vast majority of patients who become seriously ill or who die tend to have these underlying medical conditions, and cancer is not exempt from that basket of underlying medical conditions. So anyone who has cancer who contracts COVID 19 is going to, have a greater difficulty in overcoming the infection as opposed to someone who does not have an underlying medical condition. And so I say all of that to say this, that yes, even patients with cancer should be vaccinated against COVID 19. The reason for that, I'm going to be very quick to say this, there's a lot of talk that, in spite of the vaccine, people have still gotten infected with COVID 19. And yes, that is true. The vaccine is not designed to stop you from getting COVID 19. That is not the function of the vaccine. The vaccine is not going to prevent you from getting COVID 19. What the vaccine is there for is to train your body to produce the cells that are needed to fight off the infection quickly. And so the vaccine is not going to stop you from getting COVID 19, but it's going to stop you from getting seriously ill, ending up in an ICU, ending up on a ventilator, and perhaps dying. So I want to make it clear, the objective of the vaccine, the function of the vaccine, is not to stop you from getting COVID 19. You could be vaccinated today, fully vaccinated, and next month you contract COVID 19. Okay? That's not to say the vaccine has not done its job. The vaccine is doing its job. The function of the vaccine is to stop you from getting seriously ill and perhaps die. So, yes, I think all cancer patients should get their vaccine as quickly as possible.
Okay, apart from not getting the COVID-19, can the vaccine further weaken a cancer patient's immune system?
Well, I don't think that there's any evidence that the vaccine will weaken your immune system. Remember, the vaccine is trying to jumpstart your immune system to produce a specific type of white blood cells. So the vaccine is trying to give your body a signal to produce antibodies against this virus, the SARS-2 virus. So the objective of the vaccine, as I said, the vaccine is a small amount of something that is injected into your blood, so that your body can basically, a light switch in your body can be turned on, that hey, you need to produce some antibodies against this specific virus. So yes, as with a person who does not have cancer, the cancer patient may get some headache. They may feel a little ill after they take the vaccine. They may have some vomiting. They may have whatever other side effect the vaccine may have. However, what the important thing is that once they get over that, that fever or headache for a day or two, their bodies would have been stimulated to produce antibodies against COVID-19, so that in case they contract COVID-19, they have a greater chance of survival.
All right, thank you for providing such insightful information. I'm sure many persons were actually wondering whether or not the vaccine was it was okay for a cancer patient
Mhm.
to take the vaccine. Okay, so we have a question here, and it's from Theolinda Charles. And the question is, I believe this is for you, Dr. Ephraim. What if a person who never knew they had underlying condition, for example, cancer, diabetes, hypertension,
Mhm.
shouldn't they were
Be
mm,
asked.
shouldn't asked to do their checks before taking the vaccine? I believe the person is asking, shouldn't they ask to do checks before check to see if they could take the vaccine before taking it?
Well, having an underlying condition, as I said again, having an underlying condition, even if you have an underlying condition, taking the vaccine is not going to necessarily worsen
Guys,
that underlying condition. The idea is, if you have an underlying condition, you are unvaccinated, and you get COVID 19, you may have a situation where you are less capable of fighting off the virus as opposed to a person who does not have these underlying conditions. Okay? So I don't think having an underlying condition, a lot of people call my office all the time, hey, I have diabetes, should I take the vaccine? Will it worsen my diabetes? No, there's no evidence that it will worsen your diabetes. There's no evidence that it is going to worsen your high blood pressure. There's no evidence that it's going to worsen any underlying condition. What the evidence that we have is that if you do contract the virus with these underlying conditions, then you may have a problem. You may have a problem, a greater problem in fighting off the virus as opposed to someone who does not have these underlying conditions. So to answer the question of Mrs. Charles, I'm not sure it would make much sense, checking a person or checking every person who is going to take the vaccine to see if they have diabetes or hypertension or cancer, because taking the vaccine will not worsen these conditions, even if the person has them. Okay?
Thank you so much. So I gather that the message is take the vaccine.
That is the message. That is the message, Sharia. Get the vaccine as soon as possible.
All right, Dr. Ephraim, thank you so much. Okay, I'm going to go back to Miss Stapleton. Miss Stapleton, based on your experience with your aunt, what lesson did you learn from the entire experience? Did you get
Honestly, I don't even know what to say, to be real honest right now.
okay? Don't You can take a moment. We'll get back to you. Gather your thoughts. All right, Miss Pascal, we're gonna go back to you. So your faith. You spoke a lot about your faith
Yes.
during your this entire process. How have your faith? How has your faith continued to keep you grounded during this entire ordeal?
Tremendously. Um, like I said, I spent a lot of time crying and it's praying and reaching out to church members, and these kind of things is what helped me. If it wasn't for them who come and they counsel with me and they give me encouragement, I don't think I would have been able to survive everything that I've gone through. Being hospitalized back, back to back, and always being home, not being able to eat. You know, so my faith and my trust in God has kept me.
What
It has
advice would you give to other cancer patients as it relates to faith?
reach out to the church. There are a lot of churches out there that have groups that reach out to cancer patients and assist. So just reach out to any Bible believing church. You don't, I won't say you have to rush in to Christianity or rush into any other religion, but just reach out. Find a way to reach out to somebody that can help you. Somebody with a positive mindset that you know that would tell you, don't worry, you're going to get through this. You know, you don't want anybody with you that is going to say, um, I don't think you're going to make it. You know, why are you looking like this? You don't want people to be negative around you. Just have positive minded people around you, and it helps. It helps a lot. I know it's helped me.
Very good advice, Cassie. And I think the message is to have positive people around you always. We have a message coming in from Angie Henry. Angie saying she can't hear. Angie, could you unmute your speakers? I'm not too sure why you're not hearing. All right, so Dr. Ephraim, w- how often should persons be screened for cervical cancer?
The the territory, because different territories have different screening protocols. Um, where I was trained, generally women in their 20s are screened at least, well, once per year, only once per year. There's no need for screening every 3 months or every 6 months and so on. A lot of times patients call me to ask if they need to do their pap smears every 6 months, and the answer is no. Okay. Um, so generally, the way I was trained, if the woman is in her 20s, she's screened once per year. And if all of her pap smears are negative, then once she gets into her 30s, then she can be screened every 2 to 3 years. Recently, the American Congress of Obstetricians and Gynecologists, gynecological body in the US called ACOG, they have now even come forward and said that women can be screened every 3 to 5 years. So that is their screening protocol. But in general, the screening protocol depends on the country and on the age. As I said, I was trained in Cuba, and generally the Cuban protocol is to screen women from age 21, and they are screened annually. Once the pap smear, is normal, you do a pap smear once per year, and once all of those in your 20s are good, then from age 30 onward, you are screened, let's say, every 2 to 3 years, depending on the risk factors that the person has. If the person has a lot of risk factors for cervical cancer, they may be screened every 2 years. If they don't have a lot of risk factors, they may be screened every 3 years or so.
All right, thank you, Dr. Ephraim. I'd like to open the floor for any questions, any comments. I just would like to read a comment to Cassie from Nurse Benjamin. She's saying, proud of you, Cassie. You are a real inspiration. And Shante, you are doing great. Auntie Andrea is smiling down on you. So continue to be the inspiration that you are, ladies, and keep up the great work as you continue to provide awareness on the different cancers, and your story just might be an inspiration to someone else. Cassie, is there anything else you would like to share with our viewing audience? What is your takeaway message?
Um, I would advise women, as Dr. Frame said, get your regular checkups. That was my mistake. I wasn't one who went for regular checkups. I didn't care to see a doctor at all. But get your regular checkups. Get your screening. Check your diet. Exercise more. Because I was very much overweight. I had a very large midriff. So I was I don't exercise either. So diet and exercise and regular checkups. And like I said, stay close to God.
Thank you, Cassie. Dr. Ephraim, what can be done to encourage more women to get screening at an early age?
Well, I think programs like this, I think education is the way to go. Programs like these, the media, that's where we have to go. We have to educate our women in terms of the need of getting regular checkups, getting screened for cervical cancer, and checking out any abnormalities. That's something that I find that a lot of women do not do. They may see something abnormal. They may have some abnormal bleeding. It stops. They may be having persistent pain in the belly for some time. I'm not saying that you have some pain today, and you need to run to your gynecologist or to your doctor. No, but if you're noticing that, for 2 months you've been having some pain in your lower belly, in your lower tummy, maybe you need to go and check that out because it's been going on and off for 2 months. And I find that a lot of times these are the types of things that are left unchecked. So by the time the woman comes 5 years later, yeah, she has been having pain in her tummy for, on and off for 5 years. She's been having acid reflux for 5 years, and it has not been checked out. When you check it out, it's an ovarian cancer. It's not just a simple acid reflux. So I think that what needs to be done is a lot more education, because a lot of times, I find that, women are not educated enough as to the need, to check these things out. And I think programs like these, getting the information out on the media, getting the information out through all the media forms and the media streams is very important in terms of stimulating our women to get checked.
Okay, I have a final question before I move to Miss Stapleton as we wrap up this evening's session. What causes a person who would have, what causes a relapse in cancer? Someone who would have been cured from cancer, they were told that they're cured, and then several months later or a year later, the cancer comes back more aggressive and then the person dies.
Yeah, if we knew the answer to that, then I think someone would be a millionaire, and a lot more women would live. The answer to that is it's not known. We're not quite sure, which women are going to relapse, which women are not going to relapse. My personal feeling is that it just depends on the immune system again. It depends on the physical strength of the individual. If the individual is physically strong and has a good immune system, then perhaps the cancer might not perhaps the person might not relapse. The cancer might not come back. However, if the individual is a little weaker, the immune system is a little more stressed, then you may find that in a few years the cancer comes back. But to put a direct cause as to why there is this reoccurrence of the specific type of cancer, because I think I understood you correctly. You're speaking about, let's say, uterine cancer that then comes back,
Yeah.
uterine cancer.
Mhm.
Because we also see another phenomenon where a person may have uterine cancer, they are treated, they are cured, and then a few years later they develop, let's say, ovarian cancer. Or a person may have breast cancer, let's say. They're treated, they are cured, and then a few years later they develop, let's say, ovarian cancer. But is technically
Dr.
cured.
Ephraim, I think we missed some of what you said. There was a technical glitch from your
Okay,
end.
no problem. What I was saying is that why exactly a person with a specific cancer, for example, uterine cancer, who is treated and cured, then a few years later develops, a more, well, the uterine cancer comes back, and it comes back, as you rightly pointed out, in a more aggressive fashion. Why that occurs, I don't think there is any evidence to support any causative agent for that.
So the key is having a strong immune system and eliminating all forms of stress.
Yeah. Yeah.
And as Cassie would have said, have faith and have positive energy around you.
Yes, the immune system is very important.
Hmm.
It is extremely important. Diet, Cassie mentioned diet, exercise, and I have always thrown adequate rest, adequate sleep inside of that mix, because a lot of times we get the diet in, we're very picky about our diet, we're very consistent with our exercise, but we don't get enough rest. And sleep and rest is one of the key elements that causes your body's cells to repair themselves. They repair the
Mm.
daily damage that we undergo every single day. Putting a cell phone to your ear might damage some cells. We don't know. But the sleep that you get, the adequate sleep, is going to repair that damage, and that is one of the major things, or the major influencers in terms of the development of cancer.
And what about water?
Well, of course, adequate water intake, definitely, that is very important. Adequate water intake is going to help your kidneys, definitely, and your kidneys are going to help your metabolism. They're going to help your fluid regulation, your electrolyte balance. It's going to help all of those things, which in the end assist with the repair that we want to happen.
Okay, persons are saying no sound. I'm not too sure if Mrs. Ephraim is hearing because she would have asked a question. Um, can you indicate if you're hearing Mrs. Ephraim? Okay, and Mrs. Ephraim is asking, can men get HPV?
Yeah, well, men are the major carriers of HPV.
Okay.
Men
All
are the
right.
major reservoir of HPV. Most of the HPV in the world is carried by men. It's just that men will not be affected as early as women, okay? Because the cancers that the HPV is going to cause in men typically occur later on in life.
Okay. All right, Mrs. Denise, First Lady Bias. I'm not sure if your speaker is turned off, but there are other viewers that are listening via our Facebook page and they're able to hear. So check your speakers. Okay, we have a question from Mrs. Eve Henry, a Facebook viewer who is all the way from the United Kingdom. She's asking, is there education in schools and colleges regarding health education, in particular cancer awareness, and how one should examine themselves?
Not that I am aware of. I'm not aware of any specific, at least not here in the Caribbean. I'm not aware of any education program specifically geared to health and specifically geared to cancer awareness. Perhaps that is something that might need to be introduced. It's a good idea, and maybe that is something that the Ministry of Health and the Ministry of Education can look at and come to an understanding, of some sort of program in terms of raising not just cancer awareness, but some sort of health education program in the schools. And it might be an idea worth investigating.
All right, thank you. And what about hygiene? How important is hygiene in preventing some of these gynecological cancers? We touched on the HPV and health and wellness, but what about hygiene?
Well, specifically when it comes to the HPV virus, the HPV virus is spread typically through sexual contact. I mean, there are other ways of spreading the HPV virus as well. But I think most of the transmission is going to be through sexual contact, and of course, it's in the bodily secretions. Okay, so you're looking at seminal fluid, you're looking at pre-seminal fluid, you're looking at the vaginal secretions. As I said, it is a relatively weak virus. Okay, I don't want anyone to leave saying that Dr. Ephraim said it's a weak virus. It's a relatively weak virus compared to other viruses. It's not that strong compared to other viruses. However, it is in the secretions, and I would assume that proper hygiene, particularly after intercourse, would probably play a role in reducing the uh, the contraction rate.
But Mr. Dr. Ephraim, what it is about men that causes them to be high carriers of HPV?
Uh, well, as I said, typically most males who have HPV do not know that they have HPV. Um, Generally, men are a little bit more, you might say, typically a little bit more promiscuous in their teens and early 20s than perhaps women. I guess some would argue that point, but I think overall, men are a little bit more promiscuous during that period. And as a result of that, the possibility of contracting HPV would be higher in boys than in girls. Now, the other thing is that, as I said, men most likely will not know that they have HPV as quickly as women, because a woman with HPV, typically the cervix is going to begin to be affected by the time she gets somewhere around 40. And so we're going to begin to see the signs of cervical cancer and so on by that time. In men, HPV is going to cause typically penile cancer. And unless the man develops genital warts, okay, which, some men may have genital warts and not even know what it is, and they may just ignore it. So unless the man develops genital warts and seeks medical attention, and we know, hey, these are genital warts, so he probably has HPV, and we send him for some HPV testing, penile cancer is typically not going to be detected, as early as cervical cancer. Cervical cancer is going to be detected somewhere between 40 and 50. Penile cancer most likely is going to be detected somewhere between maybe 60 and 70. So the men typically do not know that they have the virus. And as a result of that, it kind of sticks around with them for a longer period. That being said, once you have HPV, you can't get rid of it. So it stays in your body. There is no cure for HPV. So once the virus is contracted, once you contract the virus, you will have the virus for the rest of your life. Whether the virus causes cervical cancer or causes penile cancer is left to be seen. But the idea is, even if you have HPV, to screen regularly so that we can see if that HPV is causing cervix cancer or if it is causing penile cancer.
All right, we have a question from Roberta Ephraim. She's asking, what is the latest age a young woman can get the HPV vaccine?
Generally, the protocol suggests that women can get the vaccine up to age 26. Okay, up to age 26. If the woman is really high risk, she can have a discussion with her physician, and the physician can determine if the benefits outweigh the risks of giving her the vaccine later than 26. The idea is that after 26, it might not make sense to vaccinate the lady because she probably would have already gone through that typically promiscuous period that I mentioned earlier, somewhere between 16 and 26. Late teens, early 20s, when typically every human or most humans, take chances in terms of unprotected sexual intercourse. So most of the recommendations are to vaccinate somewhere from about 11 years of age until age 26.
All right, thank you, Dr. Ephraim. As we wrap up, Shanti Stapleton, any final remarks? What would you like to leave with the public as it relates to being a cancer caretaker? What message would you like to leave with our audience this evening?
Just be strong for whoever it is that's going to cancer. Don't let them see that you're worrying about them because they're going to take it on. And just be there for them. Be positive. Pray for them. Tell them it's going to be okay. And things will work out.
Thank you, Shanti Stapleton, and thank you for mustering up the courage to share your experience and your story this evening. I believe your experience will inspire many. So do not take you being here lightly. So continue to stay strong and continue to keep the faith. Cassie
Thank
Pascal,
you. I will.
all right, any final remarks, Cassie?
Um, like I said, stay close to Christ, stay close to positive minded people, and keep healthy. Just keep thinking everything is going to be okay. Watch your diets and the exercises, and everything is going to be fine. It took me a while to get to that place, but that's that's all I have to say for now.
All right, thank you. Dr. Ephraim, any final remarks? What do people need to do to become more educated on the gynecological cancers? Any advice? What would you like to leave the audience with this evening?
Yeah, well, I think we, the healthcare workers, we need to continue to educate the public um, with regards to getting their checkups and getting checked regularly. You never know what might be lurking behind the scenes, so to speak. So it is very important to check your doctor regularly. And any abnormality that you notice, the idea is not to wait. The idea is not to delay, but the idea is to seek some sort of medical advice. Um, And I think that is the idea that we want to pass on to the public. Do not delay any sort of abnormality. Then you need to seek some sort of medical attention. I'd just like to say thanks to Miss Pascal and to Miss Stapleton. I think you guys did a wonderful job. It takes a lot of courage to come on a forum like this. I remember, when we made Cassie's diagnosis. I know Dr. Sawande Goodwin was also very involved with her care. He's a general surgeon at Mount St. John as well. And he was very involved with her care. He's always asking about her. I've seen her struggle along, as I like to say. She has not given up, and she has tried her best you know, to fight the cancer. And I think that's a very important mindset to have once you're diagnosed with cancer. That hey, you need to fight, and you need to try to get yourself back to where you were. You may not be able to do so 100%, but the idea is not to give up. And so I'd just like to say thank you to Miss Pascal and to Miss Stapleton for coming on a forum like this. I'd also like to say thank you to Miss Nurse Benjamin. I think her cancer support group, the idea is a wonderful idea. I think it's something that is very much needed here in Antigua and Barbuda and across the wider Caribbean, at least the Eastern Caribbean, because I think cancer support groups like these are very important. We as doctors, we can do so much and no more. But once we are finished with the patient and the patient has to go home and now live with this diagnosis, it's very important that they have some degree of support. And to you, Sharian, I think the apex of training and development, keep up the good work.
Thank you, Dr. Ephraim. And once again, you can contact the Antigua Barbuda Cancer Support Community, 722-1019. And Dr. Ephraim, could you share your information with our viewing audience, even though we have it on the banner, but you can share it again.
Okay, it's Ephraim Medical Clinic. We're located in Lower Gambles, and the telephone number is 562-9321. 562-9321. Ephraim Medical Clinic in Lower Gambles.
Thank you so much, guys, for gracing us with your presence. And thank you to our sponsor, Nagico Insurance, for ensuring that the cancer support or cancer awareness program has been possible this evening. We have a few comments coming in before we leave. We have a comment from Aisha Joseph, very informative indeed. Thank you to the presenter and the host. And we have Miss Lydia John Baptist, very beneficial indeed. Thank you, Doc. Thank you so much, Lydia, for tuning in. We also have a comment from Roberta Ephraim, very informative program. Thanks very much. Special thanks to Dr. Ephraim. Remember, for those of you who are tuning in, remember to tell a friend, tell a family member, tell a coworker. Every Sunday night, we will be here on the Apex of Training and Development show, sharing information on cancer. And next week, we will be discussing childhood cancer. And our guest will be Dr. Hannibal from the Mount St. John Medical Center and two childhood cancer survivors, Miss Janelle Charles and Kai Drew. You don't want to miss next week's session. One more comment before we leave, and this is from Aurelia Casimir. All right. Great program. Wonderful job in informing the public. Well done, Apex of Training and Development. So thanks to you, my awesome audience who were with us from the inception until now. Once again, thank you to our panel and continue to stay safe. Just a few takeaway messages. Remember to get vaccinated. Those of you who are cancer patients, you would have gotten your answer from Dr. Ephraim this evening. Remember to surround yourself with positive people and continue to increase your faith, because what I've gotten thus far from season one and now season two, one of the things that majority of the cancer survivors have spoken about is the importance of having faith and surrounding themselves with positive people. And more importantly, remember to get screened. Early screening is important
Mm-hmm.
because it will enable you to detect any cancer, whether it is at stage one, stage two, stage three, and then you'll have doctors like Dr. Ephraim providing the necessary course of action needed in order to help you to cure your cancer. Once again, thank you so much for tuning into our show, and remember to stay safe. God bless. Have a good evening.
Good evening.